lovelies, welcome to Anatomy with Dr. Jasma. We are going to talk about a doozy of a nerve today, the obturator nerve. If you're in the pelvic health field or if you're having issues with your hips, you're not going to want to miss this. Starts out in the lumbar spine, L2, L3, L4 nerve roots. Then it runs down medially and pierces the psoas major muscle. In a lucky few individuals, it pierces the tendon of the psoas minor. And this is where it gets crazy. It's going to enter the pelvis through the obturator canal right here. So that muscle that you're seeing, that's the obturator internus. It does hip external rotation. It attaches fascially to the urethral muscles and plays a huge role in our pelvic floor function. But that nerve doesn't pierce the obturator internus. So the obturator nerve does not innervate the obturator internus, but the obturator internus can affect it because what you don't see right there is the fascia that's going to be over that canal. So it's going to come down through that canal, and right here you're seeing where it is piercing the obturator externus. So far, we're piercing 2 to 3 muscles depending on your anatomy. The psoas major, the psoas minor tendon, and the obturator externus. You can see how easily it can be entrapped. Then once it's through the canal, it's going to have 2 branches. We have an anterior branch and a posterior branch. The anterior branch is going to provide motor innervation, so to move the muscles of the adductor longus and brevis, the pectineus, and the gracilis, and sensory innervation to the upper medial part of the thigh. The posterior branch is going to provide innervation to the adductor brevis and the pectineus and the adductor magnus, which kind of acts like a hamstring muscle, and the obturator externus. So the obturator nerve does not just do hip adduction. It does hip adduction, and in one of those muscles, hip external rotation. That posterior branch also provides innervation to the medial or the inside of your knee. What do you do if you have an obturator neuralgia or an obturator nerve palsy? You go see your pelvic PT. They can help you figure out exactly where that entrapment is coming from and give you stretches and exercises to help free up that nerve and help restore nerve supply. There are times where surgical interventions are more appropriate, but also trigger point injections. You can actually take D5W, if you're a physician, and inject around that nerve, and I'll post this research article in my linker up above. And we can use that to actually create an inflammatory process that will help calm those nerve pains down. So if you're dealing with pain or weakness in your inner thigh or your hip external rotators, go see your pelvic PT. Right there, that's where you find one closest to you. And if you want to learn more about your body and your anatomy, hit that follow button.